Good morning, everyone. Welcome to the webinar. We'll get started in just a moment. Glad the chat's working. Always a relief. Glad you're all here. Welcome to the Kentucky Harm Reduction and Recovery Community of Practice webinar series, presented by Voices of Hope and the University of Kentucky Harm Reduction Hub. My name is Brooke West. I am a person in recovery and the training and education manager at Voices of Hope in Lexington, Kentucky. The goal for this webinar is to bring together a group to engage in training, share best practices, and network around a common interest. The topic of our webinar is the cost of caring, secondary trauma and sustainable support in harm reduction settings, presented by Dr. Christal Badour, the Georgia Davis Powers Endowed Professor in the Department of Psychology at the University of Kentucky. But first, we'll hear an update from the Harm Reduction Hub and just a couple of housekeeping notes before we get started. If you are a peer support specialist interested in continuing education credit for this webinar, you need to complete the survey that we will place in the chat toward the end of the session. So be on the lookout for that link toward the end of our time today. And as most of you have discovered, we have the chat feature on, so you can participate during the webinar and feel free to make comments and ask questions. So today's webinar begins with an update from the University of Kentucky Harm Reduction Hub, which is a transdisciplinary initiative to provide early insights into Kentucky's street drug supply through the analysis of drug residue from used syringes. The Harm Reduction Hub has a dedicated drug analysis lab and staff, and they use a mass spectrometer, which is a fancy chemistry machine that identifies molecules, to test residue in syringes obtained from partner harm reduction agencies in the state, allowing for real-time monitoring of emerging drug threats. This syringe residue testing project analyzes trace amounts of drugs left in used syringes to detect new and emerging adulterants. Today's update from the Harm Reduction Hub will be presented as a conversation led by Casey Bitchek, a harm reductionist with over a decade of experience working in syringe service programs, advocacy organizations, and community-driven research studies, and is currently a community research associate at the Harm Reduction Hub. And I will turn it over to you, Casey.
Thank you, Brooke. Hi, everyone. Good morning. Let me get my slides up here. Those of you who attend this webinar every month know that I am not good at sharing slides. Okay. All right. Okay. All right. So today I'm going to take you through our top 10 identified substances, or well, our top three really, but as usual, and then Amanda and I are going to have a conversation talking about some regional differences we've been seeing in through our drug checking. Particularly, we wanted to do a deep dive into cocaine because we have been seeing a lot more of it in Fayette County than in other counties that we test from. But first, I want to acknowledge our funders. Thank you to Vital Strategies for funding our work. And also, I wanted to give the disclaimer that the information shared in this presentation does not represent the views of the University of Kentucky. Brooke did a great job explaining what the Harm Reduction Hub is, so I'm just going to very quickly give a little bit more of an overview for anyone who might be unfamiliar. We're a community service first and foremost. As Brooke said, we are transdisciplinary. We bring together a team of researchers, healthcare providers, and harm reductionists, and our goal is to provide early insights into Kentucky's street drug supply by analyzing residue in used syringes and then reporting it out to people who use drugs and the programs that serve them so that they can make the choices that are best for them. We test syringes from 10 partner sites across 5 counties in Kentucky. Those counties are Fayette, Jefferson, Jessamine, Perry, and Rowan County. Here are our top 10 most frequently identified substances across all of our testing sites from April. Those of you who join this webinar regularly know that our Our data is always about a month behind because we want to make sure that we are reporting accurately. I'm going to really focus on our top three here, which are fentanyl, 4A-NPP, and methamphetamine. So fentanyl is, of course, fentanyl, and we saw it in about 52% of syringes tested in April. 4A-NPP is a chemical precursor to fentanyl, so it just indicates that fentanyl was in the syringes as well, and that was in about 44% of the syringes we tested in April, and then methamphetamine was in about 43% of the syringes we tested in April. And this is pretty standard, I would say. Fentanyl and meth tend to kind of flip between our being our top two substances identified. And then before we get into the conversation, I did just want to pull out our April results from Fayette County, particularly. As I said, we do tend to see more cocaine in Fayette County than in other counties, particularly Jefferson County and Perry and Rowan County. We do see cocaine in Jessamine at higher levels than those three counties as well. So it's kind of a central Kentucky pattern that we're noticing. So I wanted to pull out that cocaine was the second most identified substance in syringes from Fayette County in April. And then also I wanted to point out this, the sixth most identified substance, methylegonine, which is a chemical that shows up when crack cocaine has been heated to a certain temperature. So it indicates to us that crack cocaine is being injected in Fayette County as well. And with that, I will stop sharing and Amanda and I can jump into our conversation. So Amanda, to start, I wanted to ask, our syringe residue testing in Kentucky is consistently showing a higher proportion of cocaine in the syringes we're testing from Fayette County than in Jefferson, Perry, or Rowan County. So to start, can you talk about challenges related to stimulant-related harm reduction?
Sure. And thank you for inviting me on here to talk to you about this. And I'm happy to talk about challenges. And maybe while I'm doing that, if anybody has any thoughts about the fact that we're consistently seeing cocaine more often in central Kentucky compared to our other counties, if anyone is surprised by that, not surprised, love to hear your reactions in the chat.
Yeah.
But a few challenges that we see, a lot of our harm reduction programs were designed and funded with a focus on opioids, of course, because of the increase in opioid overdose deaths. And so it's great that we have all of this opioid dedicated funds, but it does also mean that a lot of times there's less education for our outreach workers on stimulant related issues. And so this can leave people out who primarily use stimulants, but also it's not really aligned with the reality of our drug supply anymore. So we know now that with all the various additives and substances that people primarily really are poly substance users rather than single substance. And then also harm reduction as a philosophy and as a community way people take care of each other has been going on for decades and decades. But legal harm reduction in the United States, like public health sanctioned, starting in the 80s, was really came about as a way to reduce HIV/AIDS. And so our legal harm reduction tends to really center on syringe exchange. And so, of course, then for people who we've had, carve outs for being able to distribute syringes like outside of considering them drug paraphernalia that we haven't seen for things like pipes. So for people who might smoke stimulants, there's also could be a lack of access to some harm reduction tools that they need.
Yeah, thank you. I did want to dig into the methylegonidine, sorry. So we found this compound that's formed when crack cocaine specifically is heated to a certain temperature in several syringes tested from partner sites in central Kentucky in April. What do you think is important for people who use drugs and frontline harm reduction workers to know about smoking crack versus injecting it?
Sure. And so when it comes to injection, we would have all of the same, safe injection tips that you would give, regardless of what substance it is that you're injecting. But one thing specifically with stimulants is that people can inject them much more often sometimes rather than you might if you're injecting opioids. And so you might need access to more clean syringes, might be more likely to have injection related issues. And I'm sorry, my dogs have something about this.
No worries. No worries.
My dog, yes, very passionate about this topic. And so then also, when it comes to smoking, you would want to be able to educate people to hopefully to be able to use their own pipe and to be able to protect their lips. But I'm sure people in the chat may also have some other thoughts, so please feel free to share what you would say as a frontline worker.
Yes, please let us know. And if you have questions, please drop them in the chat. Um, just to expand on that, what would you include in harm reduction education specific to cocaine, including crack cocaine?
Yeah, and so one thing that I think is important is that sometimes I think if your harm reduction program focuses on something like distributing syringes, that we can, sometimes forget to do targeted outreach for people who are smoking. But there's a lot of evidence, a lot of research evidence that shows that when we're able to provide something specifically for people who, might smoke stimulants, the people are more likely to come in and access services. And so I know all of you on this webinar know that sometimes just being able to just bring somebody in to be able to access like the basic needs, being able to provide food, water, things like that can be really helpful. And so another thing that I think is important is, of course, you would always want to use naloxone. You never, if someone's using stimulants, they might also be using opioids, but a stimulant overdose is also really different than an opioid overdose. And I think that's something we don't talk about a lot. And a stimulant overdose can be much like the heart attack or a stroke. And so, it is important to know that unlike opioid overdoses, those are not things that you can necessarily really like take care of on your own. So it can be just really important to access healthcare for someone.
Yeah, absolutely. Thank you, Amanda. Do we have any questions in the chat or from folks in the audience? Um, Amanda, if I can throw you a little bit of a curveball question. I've been writing our newsletter, which I will drop a link to subscribe to after this conversation. But in our newsletter this month, we are featuring a study about the relationship between xylazine and rising stimulant use in Connecticut. Do you have any thoughts on whether stimulant use in central Kentucky might be related to xylazine, medetomidine, these non-opioid sedatives that we are seeing in the drug supply?
That's a really interesting question, and I have to say that I will look forward to reading about it in our newsletter. Of course, we have been in past months in Central Kentucky seeing xylazine declining, but medetomidine increasing. But yeah, I will certainly be interested to learn more about that.
I also would love to throw that question into the chat if folks have any thoughts on whether stimulant use might be related to the shifting drug supply, particularly the additives that are showing up in fentanyl.
And
I
Kevin
see.
has saying thinks he wonders if the lethality of fentanyl has become so widespread, folks aren't looking to cocaine as less risky. That's a great thought.
Yeah. We also have a question in the Q&A. Would there also be risks with crack cocaine with psychosis or other symptoms contributed by staying awake, lack of sleep, similar to what you see with meth?
Yes. And so anytime someone is using stimulants with all those issues, that's why it is also sometimes it's really important just to make sure that someone, has access to food,
Mhm.
water, helping someone try to have, a safe space, places to sleep for things like that. Yes, it would be the same as with meth.
Absolutely. Yes. Thank you. Any other, is that, no, we any other question? I see Chris is saying xylazine and medetomidine lead to profound sleepiness that persists after opioid effects from fentanyl have worn off. Yes, so um, yeah, can't know for sure, but there is a possibility that people may be using stimulants to stay awake once they're no longer feeling the effects of their fentanyl.
And this might be something that helps us transition to Dr. Badour's presentation, but I have also read articles where people have described qualitative research articles, the like using stimulants to stay awake to stay safe, to be able to feel like they could stay on guard, if they were taking other things that led to profound sleepiness. So perhaps there's something to be said for that as well.
That's something I heard a lot when I worked at certain service programs from participants who lived on the streets, and particularly um, from women and LGBTQ participants who were engaged in sex work, that meth was really important in keeping them safe and awake and alert while they were doing their work. Uh, all right. Well, thank you, everyone. Thank you, Amanda, for joining me, and thank you, Brooke, for having us. Oh, wait, I think we have maybe one other Q&A question. Nope, done. It just didn't go after I clicked answer. Yeah, thank you so much.
Thank you, Casey. Thank you, Amanda. And I didn't read a bio for Amanda. She wears so many hats. I don't know which to. It's like, okay, professor in the College of Nursing, co-founder of Voices of Hope, co-founder of the Harm Reduction Hub, and lots of other letters. But thank you, Amanda, and thank you, Casey, and the Harm Reduction Hub for your important work. Also, thank you to the dog. Next time, please show the dog for all of us. So now I'll
We
introduce
would
our.
love to be included every month if possible.
Okay, so July 7th, everybody. Circle back to the dog show. Okay, so now I'll introduce our presenter who will be discussing secondary trauma, which is such an important and relevant topic, especially for our audience of frontline workers. Dr. Christal Badour is a licensed clinical psychologist, trauma researcher, and Georgia Davis Powers Endowed Professor in the Department of Psychology at the University of Kentucky. Her work focuses on understanding recovery from the mental health consequences of violence and other traumatic events, including post-traumatic stress and substance use disorders. She is the founder and director of Science for Survivors, a platform dedicated to making trauma science accessible to clinicians, survivors, and communities. Thank you, Dr. Badour, for being with us today.
Thank you so much, Brooke, and thank you all for having me. I'm really happy to be here and joining in this conversation with you guys. Let me just share. I have some slides I'll pull up. Okay, let's see. I'm going to try and do my best to navigate the chat as well as the slides, although it would be handy if I had an extra monitor on here. It's not the easiest to navigate, but I'll do my best. Okay. So before I start, I just want to give a little bit of information on my background and sort of where I come to this conversation from, because I think that's an important thing to know. So I am a psychologist, and my background is in trauma recovery, and a lot of my work is in how we can best address post-traumatic stress disorder as well as overlapping PTSD and substance use issues. A lot of my work has been in people who've experienced understanding experiences of people who have encountered violence, but also do some work in other types of trauma as well. And while I am not a person in recovery myself, I have several very close loved ones who are. And so, in addition to my professional sphere, this is an issue that's very near and dear to my heart, thinking about the intersection of trauma and substance use. And as someone who works in and trains future mental health professionals to work in the space of trauma and substance use recovery, I think this topic of how do we continue to care when we're faced with such difficult challenges of caring for other people through their trauma and recovery is, I think, incredibly important. So I was very happy to come and talk about it today. And so I'm going to do a little bit of a discussion about sort of the landscape of some of these different topics that come up and what we know about them from the science. And I'm going to talk a little bit about, hopefully, about some maybe useful strategies. And I have built in some opportunities that I'd love to hear from folks in the chat. And I want to emphasize that this is not just a self-care talk, because I've been in many of those myself, and I think everyone on this talk knows the importance of systems and how systems need to change to support people better. So really, I'll talk a little bit about what you can do as an individual, but I'm going to talk more about thinking about what we know about effective systems and structures. So as you think about if there are things that are working within your teams or things that could maybe be improved upon, hopefully we'll leave today with some strategies that might potentially be helpful. And I need to figure out, sorry, my chat box went away, so I am not doing a good job already of navigating both. Where did it go? Let's see, chat. Okay, there we go. All right, so I want to just do a quick check-in, because one of the things we know about the importance of supporting people through trauma-related work is actually checking in on the emotional impact of how the work they're doing is impacting them. So this is just putting our knowledge into practice. And if you want to just toss in the chat real quick where you are falling today, take a moment, think about what feels the closest to true for you today. Okay, seeing some doing okays. Okay. Feeling good, doing okay, doing okay. All right, great. Awesome. Some doing greats in here, getting by, okay. Some days that's where we are. And it's an important point, I think, to just start that conversation with checking in, like, how are we today? All right. So here's a goal, some goals that we have for today's conversation. I want to help with distinguishing between some of these terms that you all may have heard. Secondary traumatic stress, what's that? What's burnout? Compassion fatigue, you may have heard as well. I really appreciate, Chris. Thank you for the meh. That's a good addition. Want to identify some of the kind of signs that maybe you're experiencing some secondary traumatic stress or burnout or some of these other common issues. I want to talk a little bit about how our own lived experiences can make us more vulnerable and also serve as strengths in many contexts that we're discussing today. And then I want to talk about some evidence-informed strategies, again, both some individual, but mostly at the organizational level, and thinking about how can we develop some practices that are sustainable while we continue to support others. And so that's really where I'm going to be looking for some guidance from you guys on what has worked, so we can share some strategies. So let's start with the beginning and those definitions. This is the boring part of the chat. So I'm going to talk really about four very related but somewhat distinct kind of experiences that people often talk about in the science. So one is secondary traumatic stress. And that looks very much like PTSD. So PTSD type of symptoms, and I'll go into a little bit more detail what that looks like in a minute. But those actually are symptoms that emerge following listening to the details of someone else's trauma, and they can happen over time, but also can appear suddenly after listening to one story. Maybe that is particularly difficult. We also hear this term called vicarious trauma. And these secondary traumatic stress and vicarious trauma are actually often used interchangeably. They are slightly different, although they are very related, and both can actually occur together. So a vicarious trauma you can think about as this like bigger, longer term worldview shift. So that when we're spending a lot of our time really working with and encountering a lot of difficult situations that the people that we work with may be encountering, it can shift our view and understanding of sort of what the world looks like and how safe we are in it, and how other people navigate the world, and that can really impact our ability to engage empathically with people, but also to engage in our life outside of work. And then compassion fatigue is another very related term. And this is the idea that, and this isn't unique to trauma, we can experience compassion fatigue in all helping professions. But the idea here is that we start to get really drained, and that empathy that really brought us to these helping positions in the first place start to get depleted, and makes it really difficult for us to continue to do the work. And then I think burnout is one that is more broadly being talked about in our society here in recent years, but this is not unique to the helping professions. We can experience work burnout across any profession. And this is really that more kind of systematic exhaustion that one can feel related to their work. And there are some different things we know that can lead to that. Okay, so let's jump in a little bit to secondary traumatic stress. So here you might notice things like having some intrusive thoughts or images or even dreams about someone else's story. You might notice yourself feeling more jumpy or on edge. You might be feeling a lot of emotions, more fear, anxiety, things like that. But you also might be feeling more numb, that it's difficult to actually feel those feelings. You might find yourself trying to maybe avoid or putting off calls to certain clients or situations that feel a little bit too close. And you might find it's getting harder and harder to leave work at work. You might notice your body's reacting in different ways, feeling kind of your like it's hard to calm that nervous system. You might feel sick to your stomach. You might have a hard time sleeping, feeling like you really just are absorbing what other people are bringing in terms of their trauma. Um, it's often, like I said, tied to specific events, can come on suddenly. And we find that for many people, this can ease with some distance from specific content that can be more triggering. So it might be a sign that maybe some breaks, maybe some pauses from clients with certain types of issues might be helpful for you, and some time to sort of re-engage with other things that can help rejuvenate. But in some cases, people can actually develop PTSD from interacting with other people's trauma. And so if you're finding that things like taking a break and getting connection with others and support from coworkers isn't enough, then that might be a signal to you that you might need some help yourself for navigating these issues. In terms of vicarious trauma, this is sort of that shift in our worldview, the lens. Like if we think about like if we wear sort of glasses that we see the world through, our lens can start to shift. And I've really seen this. I've done a lot of work in a violence space for a long time. And one thing that I have seen that can commonly happen as people work a lot in environments with survivors of violence is the view about safety in the world can really shift to where I might start to see danger in a lot of situations and people that it actually may not objectively be as high as it is because of where I'm spending my time and thinking about it. And so it can make it hard to trust and navigate relationships with people. And it can also lead to this sort of feeling of helplessness, start to make you question, like, what is my purpose? Why am I doing this? There's sort of no point. And that can be really hard then to bring your best self to your work, but also to your life, right? So that is another important part that we don't want to forget about. Um, in terms of compassion fatigue, where we start to see this show up is this is kind of the long-term chronic effects of these things, where we just start to see that your ability to bring up that empathy, to share yourself with others gets diminished. And people may start to feel numb, start to feel like, oh, I'm just going through the motions. You might get a sense that like, I'm all full. My ability to care is all full up. And you might feel like even in those moments that have historically felt like a win in this difficult space, don't anymore. It feels like sort of a drop in the bucket, if you will. And you might find that you're starting to feel that detachment. It might feel like it's protecting you from more harm, but also it really is kind of makes you feel guilty sometimes too, because you feel like you're not able to give what you want to give to others. And you might start wondering, like, is this really for me? I've heard a lot of people in this space think like, am I strong enough to handle this work? And I will say 100%, this is not a strength issue. This is a capacity and support issue, that we know that there are some tips and strategies that can really help people to navigate this. So one of the things in particular we know is that this really may improve with some genuine rest, support, distance, and connection, and that these are things that can be cultivated and built over time. And then the last one, when we think about that broader piece of burnout, we can think about this as kind of like that chronic exhaustion. You may notice it in your body feels really tired. You're not feeling it when you get up in the morning. You might be slowed, more your thoughts are jumbled. You have a hard time focusing. You might notice it in your emotions. You might feel resentful for the work sometimes, or you might feel angry toward leadership and structures and systems. Although I will say, I think there are some, there are definitely some that warrant that, but to the point where it's not productive, right? It's not allowing you to still do the work and to make meaningful change, where you may be finding you're getting not just the Sunday scaries, but you're really really dreading going back to work. You may start to really feel cynical about the work you're doing or your role in this space, and that can, of course, lead to other things like you might be calling out to work more, you might be late, you might be thinking about leaving the field. And that, like I said, can happen in lots of different environments. We know that it's more likely to happen in situations where people are feeling like they're not getting consistent support, particularly from leadership, where they are feeling like they're putting in more than's being recognized, or if they feel like there's sort of a sense of unfairness or unjustness in the systems in which they work. All of those things can lead to burnout. Also, overwork can lead us to feel this way, even when we really are valuing the work that we're doing. Yeah, so it sounds like some people have definitely experienced some of these things here recently from looking at the chat. So when we think about our peer specialists and working in harm reduction, what are some of the unique factors that we need to consider? Well, shared live experience really, I don't need to tell people who have this is, I think, a thing that people recognize. But having shared lived experience means your own history can be activated by the people that you're working with, and the line between their story and your story is thinner than for people who don't have their own story that they're bringing to the picture. And while that's your greatest strength and asset in what you bring to the work to help clients, it also is a real risk factor for your own mental health. And so it's a thing that we have to be very, very careful about in these spaces. And in particular, we know that repeated exposure to difficult things, particularly overdose events and deaths, that if there's not adequate support to help people through those situations, that really opens us up to some risk in terms of mental health. And then we work in a field that is, I say frequently under-resourced, but I think always under-resourced is a fair thing to say, with a lot of demands a lot of emotionally taxing demands on our relational interactions with other people. And sometimes in different settings, depending on what teams you have access to, you may not have access to a lot of supervision or consultation, peer consultation support. I hope that you do, and we can talk about some ways to advocate for that if you find yourself not feeling like you do have that adequate support that you need. And then another piece is thinking about, stigma. Stigma, even though we would think we in the space would be never stigmatizing each other, but we often do. And so there's still this piece that we often hold ourselves to, that like we're the helpers. So we should be able to always hold it together. But we're human and we have vulnerabilities ourselves. So those are all things that I think it's important for us to name. So I want to just, and you don't have to share any details here, but just without overthinking it, I'd like to just hear in the chat, anyone who wants to share, you don't have to, but one word in the chat about how this work has affected you personally. Okay, vastly. Oh, enlightening, wonderful. Oh, given purpose. Okay. Growth, exhaustion, emotional. Yeah. Deeply impacted, strengthened, reaffirmed, growth, drained but hopeful. I love that. Stronger, a change of heart. Okay. Had to take time off. Hey, that is so valid. Oh my goodness, yes. Hopeful, validating, empowering, and insomnia. Oh, yes. That definitely can impact your sleep for sure. I've learned secondhand trauma itself can be traumatic. Absolutely. Absolutely. Showing empathy. Okay. Eye-opening. Yeah, yeah. Challenging. Reevaluating. Okay. Maybe leading to some reevaluation of things. Yeah. Okay. So, I wanted to take a particular note about one comment. Oh, drained but hopeful. I think that that one in particular really stands out to me because I think both can be true at once, right? We often like to think about drained and hopeful, right? Both can be true simultaneously. And a key to thriving in this space is when you're feeling that drained, when you're feeling that exhaustion, when you find yourself questioning is making sure we're able to step back and also instill the hopefulness so that we can really kind of keep going and keep doing the work. So here's my pitch about why self-care isn't enough on its own because I think I've been in lots, like I said, I've been in lots of talks that have talked about, go make sure you exercise, make sure you sleep well. Like those things are 100% true. And that puts the responsibility onto the person who is doing the work and doesn't appropriately consider the systems in which we work that cause strain for us in doing what we're doing. So, we want to make sure that we're not putting the burden of the organizational structure and the systems at large on the individual worker, because what that does is it says if you're struggling, it suggests that you're not resilient enough or you're not strong enough to do this work. And that's just not true. And we know from a long time of science in this space that that approach has a limited effectiveness when the working conditions don't change. So if we leave everything in the work system the same, but you take some breaks, when you come back, it's just going to be more of the same, right? So we have to think about shifting in multiple spaces so that we can find a balance that's sustainable. And what we know is that burnout, in particular, where a lot of this work has come from, is that it's primarily driven by various systemic conditions. So, caseload is an important one. Types of cases. Do people have access to adequate education and supervision so they feel equipped and supported to do the work that they need to do? Autonomy, so being able to make choices in the work that you're doing, and then also pay and flexibility in the workplace. All of these things are really important. And so the individual practices can help, but only when the organization is also doing its part. So here's my interesting question to you all. Have you ever received any burnout advice that feels like it kind of missed the point or missed the mark? And if so, do you have thoughts on what it was or what might have been more helpful in that moment? While you all are thinking about that, I'll share definitely. I feel like I've received a lot of feedback about making sure that I can take time for myself, yet but also make sure that you respond to all these things in a timely manner and take care of all the things that are on your plate. And so sometimes that can lead to very mixed messages, right? Like when will I do both? And that can be really difficult. Okay, take a vacation, even though the work will be there when you get back. Yes, so take a vacation's great. It can be a great start for resetting, but certainly is not going to solve the problems if there are existing. Just stop doing the work. Oh, I hate that you heard that, Jasmine, because I don't think that is I mean that would solve it, but not in the way that we're hoping, right? There's a reason we came to this work. Um, Told to take a day for ourselves and have a mental health day. Sometimes time off creates more work. Thank you so much, Chris. That is so true. If we don't have changes that allow us to come back sustainably from that breather, then it just feels more stressful sometimes, which is part of the reason probably why many Americans actually don't take their vacations. Okay, so what can we do here? So let's talk a little bit about that, what trauma-informed supervision and consultation looks like and what we know can be helpful. And I say supervision and consultation here. And when I'm talking about supervision, Many of you may be in a setting where you might be in training, or you might be in a setting where you have a supervisor above you who is not just administratively supervising, like, stamping timesheets and things like that, but providing real support and professional development for you. So that's kind of what I'm talking about in terms of supervision. And then some of you might be in settings where you don't really have that everyone you work with is more of a peer. And there we're thinking about consultation. So how are you getting support from your peers? Um, yes, thank you, Matthew. I'm seeing your note here about time off and self-care doesn't remove the weight of the work. And therapy doesn't either. The work is heavy. That is true. And so we need things to help lift us up while we're carrying that heavy load. Great. Okay. Um, I'm just gonna continue to monitor the chat and things you're all sharing, and pop them in as relevant. So, um, some of you may be familiar with a trauma-informed care approach. It was an approach that was first put out by SAMHSA in 2014 and has kind of evolved over time since then. And the idea behind trauma-informed care broadly is we want to shift, when we work with clients, we think about shifting our approach from, if someone's struggling, from asking a question like, what's wrong with you, to what's happened in your life to put you in this situation, and what are the things that we know can help support you to move forward, in a way that feels right to you. And so they put forward several different principles here. And you all might be familiar with this in the context of thinking about serving the people that you work with, but you may be less familiar with thinking about it in terms of its application to the workplace and the work that you do, as it pertains to supporting other people through trauma. So this is a figure here, but I'm going to walk through each of these to give you an example of what this actually looks like. Oh, yes. I would like to comment on Dave's note here about pushing leadership and supervisors for support feels risky in precarious labor markets, especially in public health, healthcare, and social work. And that is so true. And I want to think through today I'm to talk about some specific advocacy strategies and tools. Well, one is that we may have folks who are managers here in this call and maybe thinking about, oh, how can I improve the work setting for my team? But also, I'm going to suggest some specific tools that maybe will feel approachable as like hey, I learned about this thing that could be great for our team. So I hear you though. I think anytime you're advocating for yourself, you always have to weigh like, is this going to cause more problems for me? Which is very valid. Okay, so here's the 6 principles to trauma-informed supervision. So you'll notice that the first 5 are green and the number 6 is orange. And that's because in the original trauma-informed care, cultural humility and the attention to cultural factors and historical issues of discrimination and injustice weren't actually in the original model, but have really been incorporated since then. So I want to just highlight kind of that history and evolution. So one thing is safety. So core in working with people who have experienced trauma is safety. People need to feel safe to be able to work and live and seek healthcare, and move forward in their lives. And the same is true in our organizational settings. So we have to feel safe, both our physical safety and our emotional safety. We have to be able to do hard things and hard work that you all do, without fear of judgment or consequences. And one of the things we can do as organizations is we can actually periodically assess this of our workers and I'll share with you guys, there are some resources for doing this to look at, do people feel safe in their work settings? And do they feel safe in their leadership structures to be able to convey what they need to convey? And this can be done through anonymous surveys, which can be really helpful if you're feeling it feels difficult to advocate for yourself. Another is trustworthiness and transparency. So, an important principle behind trauma-informed approaches is that people need to understand how decisions are made, They don't necessarily need to make the decisions, but they need to understand how decisions are being made. They need to have clear expectations. That's why things like very clear job descriptions, clear responsibilities, clear reporting structures, all of those things are really important. Consistent follow through, and whether that's with meetings, with rules, whatever it is, those things, even outside of what you're doing in your day to day with the clients you're serving, those set the tone for feeling supported in your workplace and not experiencing burnout. Um, Peer support is really important as well. So recognizing peers as a protected and a valued resource, which I think the harm reduction community does such a great job, much better than much of the rest of mental health. But also the dedicated time and space to support one another. So you all are supporting your clients and people you work with as peers, but checking in to see, are you getting the support that you need from your peers as well is really important. Um, Collaboration and mutuality. Supervision should be a two-way relationship, not just top-down evaluation. So thinking about things like collaborative goal setting, how can people feel like they're having professional growth in a space that is often quite challenging and taxing to continue to work in, are some of the things that help people keep going in this work. And supervisors ideally are seeking feedback from the people that they work with about, are you feeling supported and what else might you need? Um, Empowerment and choice. This is one I really want to acknowledge because the structures of our workplace, but also the systems we work in, sometimes diminish choice. One of the things that we know that really helps to reduce secondary traumatic stress, compassion fatigue, is lower caseloads, more breaks, more spaces to actually digest and make sense of what's happening to feel supported by others. And so, in some settings, that might not be possible for you. And so, I want to think about what really would be possible here. And if you don't in your teams have a regular time where you get together with peers or other people to help you process and work through some of these difficult issues that you work through on your caseloads, maybe that's something, maybe it's, well, maybe I could bring to my supervisor this idea of a peer support, a regular peer support or consultation, or a joint education regular meeting where we get that connection and that opportunity to really support one another. And that is really key as well. And then cultural humility is also important, where both supervisors and employees are actively taking a look at their lived experience and what they bring to the setting in terms of their identity, their background, and how these things actually shape their stress response and how support is experienced for them. So even if a supervisor feels like they're offering a lot of support, maybe it's something that's mismatching what someone else's cultural experience needs in terms of support. And it's really, I think, if you open up a dialogue in a workplace setting about these kinds of issues and what people bring to the table and what they need to feel supported, can be a really great opportunity for increasing that transparency and buy-in and helping people feel like I actually have a space here where my views are valued. So, what does this actually look like in practice? So, one thing we know is that we need to have in terms of a trauma-informed model, we know is effective for helping people in this space, regular protected supervision or consultation, if you're more just working alongside peers, regularly protected time that is not canceled, and it's not an administrative check-in. It's not, tell me what happened this week. Let's run through all your cases and make sure that we're completing all the paperwork. That's important. That needs to happen, but it should be process focused. And actually, a lot of the recommendations actually suggest starting these open conversations with a going around the room. And it can be as simple as what I did at the beginning of this poll of, hey, where are we checking in today? It can be something like, let's share a rose and a thorn, something great that happened this week and something challenging. It can be, as we do share a case, let's not just process what happened and how you dealt with that or what resources you provided, but let's actually check in on how did that experience impact you as a person? And those are the kinds of things that we know help people to navigate and feel supported in these settings. Um, should processing not be with a direct supervisor? That is a really good question. It depends on the structure of your setting. So there are some settings where that processing is appropriate and built into the model. Particularly in a lot of clinical settings, we do see it structured that way. Some of you may have a separate kind of clinical lead or support person in that can help you with that versus like the person who stamps your time cards. And a key to this that I want to acknowledge to your question, Jeremy, is that you have to feel safe with that person, right? If you don't feel like it's safe and it's welcome to actually have this regular ongoing processing, then that is going to open you up to that feeling of vulnerability. Like, ooh, are people going to view that I'm not able to handle this? Is this not viewed appropriately here? And so what I would say is this is a challenge, I would say, for especially for anyone who is in a supervisory role on this call, is setting the tone for this is what we do here because this is what we know um, helps our clients and helps us to sustain in this workspace. And so when we set the tone for this is normal, we ask the folks that we work with to do this. We should do it as well. It sort of shifts the conversation and the dialogue around that. But you may be in a setting where it's not appropriate to do that with a supervisor, and that's okay. That's where peer consultation, whether it happens formally or you set up something informally, if you don't feel like you have the formal ability to do so, but something regular that allows you to process. And you want to make sure, like, though, that it doesn't just turn into a venting session, which is what can happen. And we know that when people sort of co-vent over time, it feels good in the moment, but actually tends not to lead to supportive change. And so those are sort of things you have to kind of think through carefully. And if you have specific thoughts and would love, I'll share my contact information after this meeting. I can share some resources, some suggestions and strategies because these strategies really do have to be tailored to an individual person setting for sure. Great question. Okay, so other things, explicit acknowledgement of the role of peer specialists and the fact that you do bring in your own history and background, that's a huge strength, but also can lead to some vulnerability in different settings. We talked about clear role descriptions, manageable caseloads are important, cultural humility. Oops, sorry, slides are getting away from me here. Peer consultation time recognized as a core component of the work, not a luxury. Okay, so here's my other question for you guys is what's something in your own supervision or consultation structures that are going well in your setting or something that could benefit from some revision? I'm curious, do folks have setups like this where you have a group or a one-on-one where you're able to do some processing of the heaviness of the work that you're carrying? Could be that you're getting education in how to navigate these settings. Okay. Matthew says, I've worked hard to create a culture where my staff know feedback regarding my performance as a leader is encouraged and accepted. That's great. I do the same thing with my supervisees, and we have a regular recurring cadence. So it doesn't just come up when something goes wrong. It's expected. At various times when we do performance reviews, we also do them of mentorship and supervision. We have team meetings each week, frequent check-ins, clear delineation between admin supervision and support supervision. Yeah, that's really important. Knowing what the role is and where is it appropriate to do different things. Um, I like this. My role is you can say whatever you want to say, however you want to say it, just don't talk about my mom. That's funny. Okay, a lot of cultural humility, but lack transparency and peer-to-peer. Okay, so some areas of strength, some areas where some improvement could happen. Supervision can help reinforce what the goal is and help for staying on task. Absolutely. And structure within supervision can really help and make it a very useful experience. And so when teams really think about how can I most effectively structure these things and do it in a way that's going to support what the team members need, I think that's when it goes the best. Share task-related concerns with the supervisor, but metabolize emotions with a therapist. Yeah, your work doesn't have to be the only space where you work through these things. Absolutely, absolutely. I was supposed to have monthly check-ins, but it's inconsistent. And that's challenging, Stephanie. I hear that. And I don't know if where you're in, you have the ability to advocate for that more regular opportunity. Sometimes I think supervisors are very busy and don't always recognize the need for that, especially if they have good, strong employees. And so sometimes re-emphasizing that can be really helpful. Um, uh, Sydney, I'm sorry to hear that with the communication. It's hard when you don't have clear communication. And so asking for some clarity around these things could be a helpful way to advocate for some additional support. Okay, so I'm looking at our time. So I just want to, I'm going to just say one sort of last thing here because I know I need to turn it back over to Brooke. I didn't quite get through everything I was hoping to. Is I'm going to skip over this, and I want to share with you guys three quick tools, and then I'm sorry, Brooke, I'm going to take
Hey,
like
Chris.
1 extra minute.
No, hey, Christal, we're till 11:30.
Oh, 11:30. Oh, I have
So
plenty
scroll.
of time. I was thinking
So
11. That's right.
yeah, backpedal,
Okay,
backpedal.
backing
Okay,
up. I'm
you're
backing
good.
up. Good, good, good. I'm backing up. I was like, oh man, I thought I forgot that we were till 11:30. Oh, thank goodness. Okay. All right. Well, then I'm going back to my questions here. Okay. Okay, lifestyle balance is important. That is absolutely true. And that's going to get to some of the, we've been talking a little bit so far about organizational structure stuff. And I want to talk a little bit about some of the individual piece because while I'm emphasizing organization here, I it's not the only piece. There are things that are very much in your control, and we can think about those as well. Okay. So in terms of what do we know is helpful at the individual level? One thing that happens and you may resonate with is work bleeds out of work. And it's very hard to say no to more work when you are a person who gives yourself to this kind of role. And so if you're in a setting that allows work to bleed outside of work, like you don't clock out and then you're done, sometimes it can be really helpful to set up some specific transition rituals, things that you do between on your commute home or at the end of the day. You always wrap up with X, Y, or Z. Something you do right when you get home to have that hard break. For me, which I recognize is not an option for everyone, I started biking to work and home, which also helps meet sort of an exercise goal. But for me, having that mental break where I had to stay focused and because I could zone out in the car and just think about work, right? But being able to step away and have that firm break is very, very helpful for me. Also, think about a closing up ritual of sometimes making a list of these are the things I need to do tomorrow. Having sort of if you're a person who keeps sort of day to day goals, a review of the day, like was I able to hit my top goals for today? Because the reality is there's always more work to be done in spaces like this, and it sometimes can just be helpful to find ways to put things a little bit more into buckets so they don't just overflow. Another thing that's important is recognizing your own window of tolerance and acknowledging that it's different than everyone else's. And we often expect ourselves to sort of have an infinite well of support and empathy for others, and that is just not reality. Nobody does. And so recognizing what is your own window of tolerance and identifying the signs early that you might be moving into burnout or that you might be experiencing starting to move into some compassion fatigue, or maybe you're seeing some signs of that secondary traumatic stress in terms of, having the intrusive thoughts or bad dreams or difficulty sleeping, taking on someone else's trauma. Um, and recognizing those things early and starting to implement the space you need to try to see, is this something I can manage myself? Is it that I need to focus on sleep for the next couple of weeks? Is it that I need to reconnect with my loved ones outside of work? Is it that I need some quiet time to read a book? Is it that I need to exercise more? Whatever is your thing for rejuvenating, starting and taking a week vacation is not going to be my recommendation. I mean, if you can, that's great. Vacations are awesome, but more the small things that you can do day to day that keep things sustainable and manageable. And sometimes it's micro shifts, and those micro shifts don't feel like you're making a huge change, but small things matter. So I'm going to share from my own life. One of the things that I noticed is that I was less present with my son. I have an 8-year-old, less present with him a lot because I was always thinking about work and engaging in work related stuff. And I'm a kind of a person who I'm like, oh, I'll plan a big vacation and we'll reconnect, that type of thing. But he doesn't care about that. He just wants me to sit down and play Magnet Tiles with him. And so we instituted just one day a week, and it's just for an hour or two each day. Is My son's name is Sawyer. It's Mom and Sawyer time. And that time is protected, sacrosanct. Nothing will ever come in between that. And then we use that space to reconnect during that time. So it's a small thing, just a couple of hours a week. But I found for me, okay, I was feeling like that was really helping with realigning my values, so that I could show up better at work because I wasn't like thinking about how I was really distant from my son. So it has to look, sort of different for yourself, of course. Setting those limits on after hours contact. If you are a person who, if someone emails you, you respond right away, no matter what. Those might need to be things that you think about, and setting those limits. And it might be something that has to change a little bit over time if people have come to expect that you will always be available, because it's not sustainable to be on all the time. Um, Another thing is, scheduling your recovery time is non-negotiable. So putting that in your schedule first is something that is very hard for people to do, but making sure that it's in there, because if you can't show up as your best self, you can't show up for the people you're working with. And so if you think about it that way, as this is something I'm doing for others, because I have to invest in myself to do that. Another thing that many people talk about how the trauma, uh, how we experience secondary traumatization and how we're at increased risk for that, is being in settings where we don't feel like we are equipped with the tools to help. And so one thing that, and I don't know what each of you have experienced in terms of trauma focused support and recovery training, but it, if I know that historically sometimes addiction recovery space and mental health space have been treated really differently. And so I find a lot of times, when I work with my peers and collaborators who have come more in the substance use space, I hear a lot that people feel like they don't have the training to know how to effectively support people through the trauma side, which is wild to me because they obviously go so hand in hand. And so that might be something to consider if you have the capacity to do so, is seeking additional training in trauma related work. And if you need guidance or support on resources that could be helpful in your professional role, that's something I'd be very happy to suggest for you all. Also, seeking supervision from people who have competency in how to address these things. So if you're feeling like, I don't know what to do here, it's hard if you also go to a supervisor or your peers and they also don't have those tools and experience. That can really be a challenge. Okay, so those are some individual pieces. In terms of the relational component and how we interact with others, we've talked a little bit about the idea of a peer consultation system. Sometimes this is if there's one person in your organization that you trust, maybe think about you schedule a monthly or a bi-weekly, even a lunch that is designed to be structured on providing each other support through navigating these difficult spaces, and that you structure it in a way that will prevent it from just turning into venting, and how to actually think about how you can improve the workplace and the work you're doing. Asking explicitly for what you need, recognizing that that can be difficult depending on how your organization functions and how open your supervisors are to things. But there are small changes I think that many people would be open to, that a lot of times folks are hesitant to ask or nervous to ask about. And so thinking about some spaces you could advocate for yourself, and we can talk about what those could potentially look like. Normalizing talking about the emotional reality of the work. And here I'm speaking in particular to people who are supervisors. If we don't model that it's okay and that it's expected to talk about how hard and challenging emotionally this work is, that does not open the door for the people who are in the position of being evaluated to do so. So we need to make sure that we're doing that. And then building connections outside of your immediate team too. Thinking about in the workplace, other people who you might have positive relationships with, who you might get some of that rejuvenation, but also, of course, outside of work as well. Making sure we're nurturing those important relationships. And then we've talked already about the structural level in the organization, so the team check-ins, also a structure and an expected a protocol is really helpful in settings where we expect losses or where we expect really difficult cases to happen. So what is our team going to do when there's an overdose or loss? Or what is our team going to do if there's a suicide? Those kinds of things. And yeah, that's really helpful. And then also a clear secondary trauma leave policy. This is an organizational issue that I think anyone who's working in this space should have an approach so that our employees aren't feeling like if they are struggling, they have to come and ask, that it's already in place of what they can do if they're finding that they need the space and the support. Some organizations have programs that you can seek, like EAP type programs where you can meet with a counselor through your work and benefits. Some have policies where you can take mental health days, although from the chat, I know that that kind of has mixed feelings. You may have like a formal leave policy structure if you need some time off. All of those things are really helpful for sustainable, meaningful change in this space. And I want to look at Kevin, I saw that you had a note here. Any tips on how supervisors might structure the agenda during weekly one-on-one check-ins so that emotional bandwidth is routinely discussed and not just an afterthought or awkward? I actually don't think this is an after the presentation. I think this is such a good question and a really important one. I really like to start the conversation with it at the beginning because it emphasizes the importance of it. Now, there's always the challenge you have to navigate of you probably have a lot of administrative and other things you have to get through in the meeting as well. But what we don't want to do is set the tone that like it is an afterthought, right? If we leave it to the last few minutes when we run out, and people are like ready to go and they're packing up their things, it's not an awesome time um, uh, to then open up and be vulnerable, right? So I like to think about starting it that way and just setting the cadence of we're going to set an agenda every week for what we are going to cover, because if we're going to run out of time, if we're following our agenda of the most important points we need to hit, it's going to make it more likely that we stick to that agenda. So that's something I always try and do. And then thinking through, okay, set aside a designated period of time so that it does not just become a full processing session. And if someone's had a really difficult situation and they need more processing, then when we get to the end of the processing time, then we have a structure in place where, like, if you need more support, we're going to schedule another session. We're going to schedule another check-in time, either a one-on-one or we'll revisit it next week if that feels appropriate. That's how I would typically structure these types of supervision consultation environments, so that this is just what we do, right? It's just part of the routine. That's a really great question. Okay. All right. So I want to think about a shift from coping, which is, I think, what most of the time we in these professions are doing. We're coping with the stress of the everyday of the work that we do. Um, we're managing to get through the day. It's absolutely necessary. We have to do it, and it's not enough on its own. It our individual coping works best when the system is doing its part. And so when we want to move from coping to sustainability, we want to think about what are some things we can put in place in our organization where you can keep doing this for years and remain healthy, because you shouldn't have to be sick to do your work. You shouldn't. So, how do we do that? How do we make sure, from a workplace safety standpoint, we help people to stay well? And setting these structures and being very intentional and thoughtful about it is what we know can be most beneficial. And pay is awesome. If you can pay people more, it really helps. But in a lot of cases, that is not the only lever that we have to pull. So let me talk about a couple of concrete tools that you could potentially advocate for in your own setting. And then I want to open it up for discussion and questions and brainstorming. So these are three concrete tools that we know from trauma-informed supervision research that can be really, really helpful. One is a secondary traumatic stress scale that is I would recommend anyone who is interacting with and working with people with trauma that there is a regular recurring period of completing this. Now, this can be self-reflection. This does not need to be like your employees all need to submit this to you and you as a supervisor review it, right? There's some concerns there about privacy around willingness to disclose and concerns around that. This is a reflection tool I would recommend for you as an individual, and that your supervisor may recommend or ask people to complete to do sort of check-ins on how their health is going. So the secondary traumatic stress scale, I'll share it with you. But there are others. This is not the only option. There are some burnout scales if you were wanting something a little bit more general to look at workplace health and functioning. But it's good to have tools so we can actually see where people are and how they're thriving or not in the workplace over time. So that's one. Another is a vicarious trauma prevention plan. So we know that vicarious trauma and all of these other concepts are a major occupational risk for the type of work that we do. So just like in other occupational settings, if you think about if you work in a factory, there's lots of safety planning in place to prevent injuries that are preventable. And we can do the same in trauma-related work if we're very thoughtful about it. So I'll talk about that. And then also a supervision agreement. So if you have a supervisor, again, with that transparency and mutuality and collaboration, a formal agreement about what is my expectation as a supervisee, and then from the supervisor, what is the expectation from them? So that there can be clear agreement and accountability. These are three really concrete tools. Oh, and at the bottom here, at PCAR, Trauma Informed Supervision Guide, this is actually developed in the rape crisis and sexual violence support resource world, but the tools are wonderful and could really, I think, easily be adapted to a harm reduction space. So I put that up here, but then if you'd like to specifically find it, I would be happy to share that with you at the end. I'll share my email and you can reach out to me. Okay, so here is an example of one of these scales. Again, there are multiples depending on what you might be wanting to assess. But this one is specifically the secondary traumatic stress scale. And it assesses those secondary traumatic stress symptoms. So if you're familiar with PTSD at all, you'll notice that some of these look similar, but they're specific to work because that's where we encounter this. And you can score that up and see where you're falling in this spectrum, which can be a nice step back and take a look at how am I doing right now with this particular issue. So that's one. Another tool, as I mentioned, is a vicarious trauma prevention plan. These are, I've seen adapted in a lot of different ways for different organizations. So rather than show you one specific one, I wanted to just kind of talk about what are some of the common things that we actually see included in these and what can be helpful. So one piece is the secondary traumatic stress scale score, something that you can track over time to see, you might do it quarterly or annually to see how you're doing in that space. Another is current self-care methods. So actually taking time to basically develop a self-care plan. How are you nurturing these different aspects of yourself? How are you taking care of your cognitive health, your physical health, your spiritual health, your social recreational health, your verbal health and interactions with others? How are you doing that? Um, what are your strengths? What are you bringing to the table? Because it can be easy to forget that in times where we're feeling really burnt out. And who supports you? Identifying your supporters in your life, and how you're seeking connection with them on a regular basis. Another piece that I think we undervalue a lot in the organizational space that we know can be really helpful is setting both professional and personal goals, and that these goals should be in alignment with our values. And our values are the things that are kind of core to us, that we kind of directions we want to go for our life. If we value connectedness, then we want to be spending more of our time connecting with others. If we value, I'd imagine many of you value things like justice and fairness. And so working in spaces that are trying to promote well-being for all people is really important to you. And so checking in with what do you value, and setting professional and but also personal goals in alignment with that can really help you in this space to make sure you're not getting off of track. And making sure that they're concrete and time limited. So you might set weekly goals, you might set monthly goals, you might set annual goals. And that is something that can be really helpful to do formally within a team so that people have that structure and regular check in. Another piece that often happens in these plans is a consideration of what do you need to stay healthy, right? If that's the goal, what is it that you need from your supervisor? What do you need from your coworkers? What do you need from your organization? And then what do you need outside of that? And using that to inform conversations around advocacy and to think through how do I continue in a sustainable practice. Um, and then the last piece, which is these are pretty interesting. These are formal surveys. So I mentioned this at the beginning in terms of safety. So there are a number of these. And if anyone is specifically interested, I'm happy to share some resources where you could look at adapting this for your organization. But there are organizational support inventories that can be administered to all employees that look at things like, do you feel physically safe in your environment? Do you feel emotionally safe in your environment? Are you getting the training you need in various topics? Are you getting consistent supervision? Do you feel like your caseload is manageable? Do you have time to take breaks? Are you feeling mentally well in your work? And if a workplace administers these broadly, it can be really helpful because then you, as the individual, aren't feeling like you're having to go and advocate for yourself. That data is available for everyone. So that can be a really helpful tool to regularly implement. Okay. And then the last one I will recommend as a concrete tool is the supervision agreement. These I've seen them look all kinds of different ways in terms of being tailored for the individual setting and the relationship. But this is one that might be a pretty safe place to start in thinking through, if you wanted to have a more formal supervision, talking with a supervisor about that and what could be helpful for you to get from that. So these are contracts basically between a supervisor and supervisee, and it allows that mutuality discussion around what should this look like to be most helpful. So usually it includes details about what's the frequency, time of day, and location of the supervision, confidentiality, what's expected around that, the supervisor responsibilities, what are they going to bring and provide in the supervision. What is the supervisee going to do? What's expected of them? And this is helpful as a supervisee because you want to know, like, I think I'm doing the things I'm supposed to, but if that's not ever been clearly communicated to you, that can lead to some friction in the workplace. So being prepared, active, accountable for their development, what you should bring in terms of paperwork, all that kind of stuff. And then a discussion on how and when that agreement will be reviewed and how often it will be updated and revisited. And that, again, just sets that tone for like, this is something we do. It's part of our system. You don't have to bring it up when it's a problem because there's already a built-in opportunity for review and correction. Why this is important in this space, because then supervision is less likely to get canceled or replaced with task check-ins, which then pulls out the support component, just makes it about, checking boxes. Both parties are clear. We increase that mutuality. It also opens up that opportunity for autonomy and choice and discussion around what are we going to be doing here together. And you have a document to go back to if things start to break down. And it's also, as a supervisor, it's a signal. I take supervision and the care of your professional growth and well-being very seriously. And this is not sort of an optional ad hoc component. And when employees feel valued and they feel like their growth is recognized, that can go a long way, even when the demands of the work are heavy. So these are some changes we know can really make a big difference. Okay, so I want to actually kind of open up to discussion, questions, and if you don't have discussion or questions, I wanted to leave this here for you to think about. And you can put this in the chat, but this is really for you. Just to take a couple minutes to reflect on these different levels. So what's something realistically that you can do for yourself this week that might help you move a little bit more in the direction of your values and sustain you through the work you're doing? Something small, something realistic, because we have to start somewhere. What's something you want to ask your supervisor for, if that is appropriate, even if the conversation feels like it might be challenging? And what's something that you want to advocate for in your organization, even if it's something that can't get done right away, but you'd like to see move in that direction? So these are some areas for reflection. And wanted to, again, just open it up for thoughts, discussion, questions, feedback from me. If you're like, absolutely not to all of this, that's fine too. Whatever you might want to share. And I'm just gonna come back to this if you need it. But this is my closing, is you deserve systems that see the cost and share it with you. So I just want to thank you guys for everything that you're doing. And I just want to share some resources here for some other things that you can look to as some resources. My email address is down there at the bottom. If you have specific questions, would like me to share any specific resources with you, please do reach out to me. Okay, Evan, I forget or neglect my own therapy. It's been becoming an issue in my life, and I feel like there's not enough time or I can't afford to slow down. What I would say to that is that is so valid. It feels like we're never time rich, right? We're time poor. We're always hustling for one thing or another. But if we neglect our needs long enough, our bodies will force us to slow down. And we'd like to try to prevent us from getting to that space. So if we can, like prevention, right? We are all about prevention with the folks that we work with. We need to do it for ourselves as well, Oh, glad to hear that the organizational support inventory, Kevin, sounds interesting. Yeah, I think it's really great. Um, Brooke, am I able to share the PowerPoint with folks?
Yes, we can add it to our webinar archive. So
Excellent.
if you
I
send
would
it
be
to me,
very
I can
happy to
post
share
it.
it. Yep,
Great.
very happy to share it. And I included some links here that are clickable so you can see some of these other resources. Oh, I'm so glad to hear that, Evan, that you've made contact and scheduled some self-care. That's great. I think self-care is a thing, Jacob. I'm glad you said that. You feel like you struggle with self-care. I think it's the thing we all struggle with. And the important thing is we never arrive there. It's just always how am I doing with it today? How am I doing with it this week, right? It's a constant like check-in that we need to be doing with ourselves. Great. Margaret, I would be happy to share more information about burnout broadly. Many of these tips and strategies are also helpful, but there are other resources as well. I'm glad that some folks are finding this to be helpful. I don't think we talk about it enough. Thank you, Christy. She mentioned the factories taking extra caution with safety, and that we need to do the same. Absolutely, we just have different occupational hazards than they do. We just need to make sure we're focused on them.
Well, thank you so much, Dr. Badour, for being here today. Like, I just resonate with everything that's being said in the chat. This was so helpful. And I'm going to put the link for the survey for peer support specialists also to get their continuing education
Great.
certificate for attending today. I'm going to put that in the chat again. And I feel really honored that the presentation I partnered with Kiprick, the Help the Helper, presentation about self-care boundaries and empowerment made the resource list.
Yes. Oh, what a great. Thank you. Yes, I love
Uh,
to see that.
um, we also have a developed with Kiprick a trauma-informed approaches presentation. Just gonna that one hasn't gotten as much airtime yet, but I need to promote it a little bit more. So
Oh, well, Brooke, if you send it to me, I'll add it to this list before I send you the slides.
I will. Thank you so much.
Yeah.
That's so kind of you. And I just took so many notes, so many things you said resonated. The importance of reflection and self-reflection. Because if I'm not self-reflecting, I just kind of feel like I'm motivated by these forces I don't even
Yeah.
understand. And I just am kind of like riding waves and
Yes.
it's
Yes.
confusing and I'm lost. And that barrier to self-care being there's not enough time. I hear that so much and I say that to myself and I will carve out time for myself, but then I have the issue of attention. And
Mm,
it's like so I'll have the time, but then it's like I'm not giving my attention to my self-care. It's like
yeah,
instead I'm dissociating on TikTok or something. And like
that's right.
sometimes that's adaptive and it's like I just need some numb out chill time, but when all my time is absorbed with those with zoning out, it just doesn't feel like I'm really metabolizing anything or actually
Yeah,
recovering.
absolutely. It takes practice
Yeah,
to retrain our attention to have that mental space for sure.
absolutely. And I love how you put I have to invest in myself to best show up for others. Yeah, because how we care for ourselves impacts how we care for others.
Yeah.
So that was just so great. And yes, we will add the slide deck to our Voices of Hope website in the webinar
Great.
archive. I don't see any other questions coming through the chat. Any other parting words before you leave us on vacation?
Yeah, so I'm going to go do some self-care myself.
Yes.
I'm going to try to
Good.
practice what I preach. No, this has just been so delightful. I'm very happy to be a part of this. I think this webinar series is so great. And I'm really glad that, if for anyone in here who might be feeling like you maybe don't have all the support you need, I mean, I think this community is a really incredible one for starting to work toward building some of that. And if you maybe don't feel like you can talk to someone in your organization, I think there's a lot of people who are part of this community who would be, eager to be a buddy. Just something to think about.
Yeah, and if I'm not seeking that out, then I'm not finding it. So like you have to put some intention into
That's right.
trying to find the
That's right.
resource.
That's right.
Yeah, so thanks again to the Harm Reduction Hub and to you, Dr. Badour, and everyone for being here at the webinar today.